This is part 13 of the series, The State of the United States Economy and Society in 2025. I'm Edward J. Dodson. The subject for this module is there a crisis in healthcare? Well, the nation's medical system is failing to deliver high quality, affordable healthcare to many of our citizens. At the same time, the cost of this care is absorbing an increasing portion of individual and household income and savings. The debate continues over what reforms, if any, are needed to ensure that all persons have access to necessary health care. As this chart shows, total spending on health care in 2022 was just under $4.5 trillion. By 2024, the number increased to $4.9 trillion, out of which $1.7 trillion was spent by the U.S. federal government. Rising healthcare costs in 2024 significantly impacted middle-class economic security by forcing people to allocate a larger portion of their income towards medical expenses, leading to reduced disposable income, potential medical debt, delayed or foregone necessary care, and increased financial stress. All of these challenges potentially impact the ability to save for retirement or for other important goals. Passage of the Affordable Care Act, or Obamacare, is considered by many as one of the largest social reforms of the 21st century. In the decade since it took effect in 2014, the share of Americans without health insurance fell sharply and now stands near at an all-time low. Even so, almost 26 million people in the United States continue to lack coverage. Almost everyone agrees that the U.S. healthcare system needs to be restructured. The cost keeps spiraling upward. The level of care is uneven around the country, and far too many people have poor health. However, there is no consensus even among medical professionals of what changes need to be made. One option is a single-payer system. As with any such systemic change in healthcare, two questions arise. Would it be cost-effective, and would it help or hinder the delivery of quality healthcare to everyone? An editorial published in 2016 in the American Journal of Public Health in favor of a single-payer system was signed by physicians from 48 states and the District of Columbia. Support from the physicians for a national health program expresses the following view. Private insurers waste our healthcare dollars on things that have nothing to do with care. Bloated overhead costs, including underwriting, tracking, billing, and sales and marketing campaigns, as well as exorbitant executive pay and an overweening imperative to deliver maximum returns to private shareholders. In addition to the above, doctors and hospitals have to maintain costly administrative staffs to deal with the complex bureaucracy stemming from this patchwork of multiple payers. As a result, administrative costs consume about 1/3, 31% of Americans' health dollars, most of which is waste. Single-payer financing, that is, the elimination of the private insurer middlemen and their replacement by a single streamlined nonprofit agency that pays all medical bills, is the only way to recapture this wasted money. The potential savings on paperwork, more than $500 billion per year, is enough to provide comprehensive coverage to everyone in the country without increasing overall U.S. health spending. Dr. Steffi Woolhander, a professor of public health at the City University of New York's Hunter College and lecturer at Harvard Medical School, comment as follows. We can continue down this harmful path, or even worse, take an alternative, free market route that would compound our problems. Or we can embrace the long overdue remedy that we know will work, the creation of a public-financed, non-profit, single-payer system that covers everybody. Today, we're saying we must quickly make that shift. Lives are literally at stake. Proposals from conservative think tanks and others on the right argue the case for what they see as choice and less direct involvement by the federal government. The Trump administration will almost certainly not support renewal of the Enhanced Affordable Care Act subsidies passed under the Biden administration when they expire at the end of 2025. The Trump administration plans for deregulation and a market-driven system, which they argue will foster competition and stimulate innovation while reinvigorating efforts to tackle fraud and abuse. By decentralizing control, one outcome is to empower states to design and implement healthcare solutions tailored to their unique needs. The expectation is that this will reduce bureaucratic inefficiencies and promote localized innovation. On the other hand, we could end up with a more fragmented regulatory landscape and in some states a significantly reduced level of funding by state government. During Donald Trump's first term as president, his administration put forward two proposed changes in the rules designed to loosen regulations governing health plans. One was to expand the availability of short-term coverage plans that last less than a year. The other was to make it easier for self-employed persons and small businesses to band together to form group health plans. In response, 98% of healthcare groups submitted objections. Comments from insurance regulators, attorneys general, and other officials across the country were also highly critical. That the healthcare system in the United States is in need of systemic reforms is evident by the fact that outstanding medical bills were the cause of about 40% of all personal bankruptcy filings in 2024. Nearly 3.1 million U.S. residents died in 2023, as reported by the Centers for Disease Control and Prevention. This was slightly lower than in 2022. Nearly 2,500 people in the U.S. die from cardiovascular disease every day. The American Heart Association issued a report in January of 2025 that stated the deaths from cardiovascular disease in 2022 totaled 941,652 people. The National Quality Forum, an organization working to improve the quality of healthcare in the U.S., finds that the challenge is huge. They write, recent studies have indicated that American adults receive recommended care only about 55% of the time. That disparities exist in the way care is delivered to racial and ethnic minorities, and that 30% of healthcare spending is wasteful and produces no value to the patient. So let's move on. What about drug, alcohol, and tobacco use in the United States? Current statistics indicate that 28.9 million people in the U.S. aged 12 and over have an alcohol use disorder. This is about 10.2% of the population in this age group. According to September 2022 data, 14.6% of U.S. adults reported current tobacco use. Among all adults, the most commonly used tobacco product was cigarettes, 9.4%, while among a subsample of young adults aged 18 to 24, the most commonly used tobacco product was e-cigarettes, 8.6%. Current use of multiple tobacco products was more common among young adults compared to adults overall, 3.2% versus 2.1% respectively. The Centers for Disease Control and Prevention and the U.S. Food and Drug Administration have released new data from the 2024 National Youth Tobacco Survey, revealing that current tobacco product use among U.S. middle and high school students has dropped to the lowest recorded level in 25 years. Within the past year, at least 500,000 fewer students are using tobacco products, contributing to this significant progress. Despite the overall decline in youth tobacco use, e-cigarettes remained the most commonly used tobacco product for the 11th year in a row, with 5.9% of youth reporting current use. In 2024, nicotine pouches became the second most commonly used tobacco product among youth at 1.8%, followed by cigarettes 1.4%, cigars 1.2%, smokeless tobacco 1.2%, other oral nicotine products 1.2%, heated tobacco products 0.8%, hookahs 0.7%, and pipe tobacco 0.5%. The National Center for Health Statistics reported in January 2019 that over 70,000 people died of a drug overdose. This included the use of illicit drugs as well as prescription opioids. As has been extensively covered by the mainstream media, the sharp increase in deaths is attributed to the use of fentanyl and fentanyl analogs. Now let's take a look at violence in our society. As this chart indicates, violence is the number one cause of death for African American and Latino males aged 15 to 24. Scientific studies show that violence operates like an epidemic disease. Domestic violence is also an epidemic in the United States. The National Coalition Against Domestic Violence reported in 2016 that every 9 seconds a woman in the U.S. is assaulted or beaten. 1 in 3 women and 1 in 4 men has been a victim of physical brutality by an intimate partner. Statistics gathered by a team at Joslin Law Firm reveal that around 24 people per minute are victims of physical violence, rape, or stalking by an intimate partner. About 1 in 3 women and 1 in 10 men experience some form of physical violence by a partner in their lifetime. Annually, domestic violence causes over 1,500 deaths and 2 million injuries. Close to 85% of victims are women, and every day 3 women are killed by an intimate partner. On a positive note, U.S. gun homicides are declining dramatically, down 13.1% since 2023 and 16.4% since 2021. However, even with the historic decline in the U.S. murder and gun homicide rates in 2023, gun violence was still elevated last year nationally compared with pre-pandemic levels. Let's now take a look at medicine and bankruptcies. An analysis by Gibbons Advisors in mid-2024 of the healthcare sector Chapter 11 bankruptcy filings from 2019 through 2024 revealed that in 2023 there were 79 institutions with liabilities above $10 million filing for protection. 2024 filings were on a pace for fewer than 60 by year end. Filings by very large companies moved in the opposite direction. Ronald Winters, a principal at Gibbons Advisors, commented as follows. The very large bankruptcy cases with liabilities over $500 million include sizable healthcare enterprises. So when you see 6 such cases filed year to date, that represents a much bigger number of healthcare facilities. We are seeing elevated financial stress in nursing homes, senior living, pharmacy, physician practices, and rural and standalone hospitals, strained by legacy debts, cash shortages, and profitability challenges. And so that completes the analysis of our crisis in healthcare. What's next? Next, the crisis in our system of law and law enforcement will be examined.